Dr. Hilton, first, let's get into Dr. Fauci's assessment that another lockdown is unlikely despite rising cases and breakthrough cases among vaccinated Americans. What then would it take for another lockdown? What would trigger that?
Right. I'm not sure what it would trigger. Right now, modeling is showing that we may be anticipating 200,000 cases a day by September 1st. Models are also showing we may be up to 4,000 people dying a day by October 1st. I feel we've been always playing catch up when it comes to COVID-19, and we need to start being proactive in our response because it's not forgiving. And at this point, with the new findings of even our vaccinated persons, although vaccines have done a fantastic job at keeping us out of the hospital and keeping us alive, you're literally 25 times less likely to die if you're vaccinated. But what are the consequences of vaccinated persons being infected? Will we develop the USA variant that is going to be able to evade the vaccines, not only for us, we got to be not so selfish that we don't think about the rest of the world. It's only 14% vaccinated at this point.
Dr. Patel, as someone who has shaped, federal health policy, when you hear Dr. Fauci talking about the unlikely situation where we would end up in a lockdown, does that sound right to you? What are the conversations that you think are being had behind closed doors?
Yeah, Alicia, it does. And I have to be honest, it's because we know that out of all the measures we've had, travel restrictions and lockdowns really had the least effect on kind of stopping this virus. And we now know that obviously vaccines are the best wall of defense. And the next layer of defense really are masks. That's why we're asking people to wear masks. It's not a reversal. It's just an additional layer of precaution because, as Dr. Hilton mentioned, we haven't even gotten to the kind of peak of where we're at. I hope we do in the next several weeks, but we're still looking at more cases every day.
Yeah, I also want to ask you, Dr. Hilton, this is what the NIH director, Dr. Francis Collins, said about when vaccinated people need to wear masks. Take a listen.
If you're talking about a small party like I might have at my house for 6 or 8 people who are all fully vaccinated, I do not believe at this point we need to put masks on to be next to each other. But if there were 100 people, and of course, how are you really going to be sure about people's vaccination status? And maybe there's some immunocompromised people there who, though they're vaccinated, are not actually fully protected, then the dynamic changes a little bit.
Dr. Hilton, I got to admit to you, it makes me wish that I was better with statistics because I think that's sort of fundamentally what we're asking people, right, to run their own risk assessment.
Right. And I think that's what everyone has to understand is that there is always a risk, right? And it's what risk are you willing to take? What we know is that right now, when we're looking at Provincetown, for instance, we know the majority of those persons, 74 to 80% of that population was vaccinated, and they still had an outbreak. And again, when we're talking about these numbers, the United States has been really hyper-focused and obsessed with just the death count. But I say again and again, there are more consequences of COVID-19 than just death, including long COVID, of which studies show that persons who are infected between 10 to 30%, including our children, are developing these long symptoms that have lasted for better parts of the year. What does that mean? What does that do to your body? And what does it do to the increased incidence of you developing some of these chronic illnesses related to brain injury, heart injury, lung injury, you name it? It's not worth it. So if you have to question it, put on a simple mask. It does not hurt you.
Dr. Patel, all of this, as this is happening this weekend, Israel began offering a third shot of the Pfizer vaccine to people 60 and older. And starting next month, Britain is going to offer booster vaccines to 32 million people in the country. The FDA, the CDC, the World Health Organization have said boosters are unnecessary at this time, citing a lack of data. What do you make of boosters? Are they being too precious in that desire to have all of that data?
Yeah, Alicia, look, I think we've mounted incredible data, especially for healthcare workers, people over the age of 60, organ transplant recipients, HIV patients, patients on certain medications. The list goes on. These are patients for which there is very solid evidence and data that a third shot of the same doses of mRNA vaccines can be incredibly helpful in increasing antibodies. Having said all that, I would take getting more Americans vaccinated the first time around any day, because that will help us all, including those of us that probably need a booster. Here's what's the regulatory hurdle, Alicia. We can't just give people a third shot, even if we wanted to, because we're under emergency authorization. So we need a combination of FDA action and CDC recommendations, I think the good news is that this mounting evidence is going to result in, one, the drug being safely approved, the vaccine being safely approved and being able to then offer boosters. But at least it's not as if giving boosters is some logistical ease. I mean, we need to start planning today for whatever that booster might look like, because you and I both know that it's going to take months to get that logistics, because all Americans are going to be in fear that they need one, and not everyone will necessarily need one right away.